Dr. Sophocles, I'm so honored to have you on the show. 30 plus years of experience. You're clearly more than just an educator. You're an advocate and somebody who's committed to helping women. And you've got this beautiful new book out or coming out by the time the interview is out. It will be out in the world. It'll be launching that week called The Bedroom Gap. And I'm curious, why did you want to write this book? What impact do you want to make? And like, why now?
hmm I think the book actually, I started thinking about writing it um, as COVID was hitting. It gave me, I was working grueling hours because a lot of the practices had closed down in my area in Princeton, New Jersey, and
Hmm.
so my practice stayed open almost as an emergency center for women. So we were there, 6 a.m. to 10 p.m. and it was brutal. But I would come home and I was so exhausted. I couldn't really do anything. So I could just think a little bit. And I started reflecting on the the women that I was seeing and the women that were talking to me about menopause. And for 20 years, I'd been having menopausal patients telling me I something's wrong with me or my doctor doesn't think I should use hormones. All these menopausal issues that we're hearing about now, I've been hearing, well, for 30 years, but for sure in the last 20, I was really paying attention. And I started noticing that among all the menopausal issues, the ones that were most bothersome to women were the sexual ones. Not most bothersome, let me say that again, the most shameful, the most
Hmm.
private, the ones that they just theirs alone. Um, and put these in. And they would say things like, I guess I'm broken. I guess it's just me, but I don't want to have sex or sex hurts. And it took so much courage for them to even say it. And they kept phrasing it in a way that really bothered me. They would say, well, I kind of have to get back to having sex because men have needs and sex is for him. So I really owe him that. And I started thinking bigger than just medicine. And I even started thinking bigger than just menopause and vaginal dryness. I started thinking socioculturally about the forces that shape who we are as women today and how those forces we carry the messages all the way through adulthood. And then when we're in midlife and we get changes in libido and changes in vaginal health, the gender roles that we've carried really start to fail us. And we start to fail what we think we're supposed to be, society wants us to be, which is sort of sexually vibrant forever. And I started examining those forces and I found that it was history and concept of patriarchy and the role of pornography and even the role of pharma and NIH funding and all these ginormous forces in our society affect who you and I are as women and the pharma options we have to help ourselves. And this goes way beyond sexual health, but for sexual health and the shame with which we feel we're aging or failing our male partners. But even these issues affect same-sex couples too, when women can't have sex or don't want to have sex. So I coined this term the bedroom gap, which according to Oprah is a real term now. And my niece, who is getting her PhD in psychology, said her psychology professor says it's actually a real concept now that they're teaching to psychology classes, which is cool. It's the difference in expectations and abilities between sexual partners, most commonly between men and women, but even in same-sex couples, that makes that results. The problems we have in the bedroom result from so many of these forces. And so closing the bedroom gap is hard, but possible. And I thought it was worth writing a book about this specifically so that women and men could read it, could understand what men are feeling, what women are feeling, how we got here, and what either men or women or couples can do to acknowledge it, communicate about it, restart a dead sex life or begin a sex life that they've never had, own their own sexual pleasure, how they could communicate with their children better so the next generation understands that pleasure is a mutual thing. I think the sex ed in our country, whew, really needs to get revamped. Well, in 47 states anyway. And I think medical education needs to get revamped. The fact that most doctors don't have training in how to talk about sexual issues.
Yes.
69% of women have never spoken with a doctor about any sexual issues. They just feel it's not polite or their place. And of course, they get those messages from the doctors who say, well, your blood pressure's fine, your thyroid's fine, anything else, all right, gotta go, and there's no space for it. And the
Right.
doctors are uncomfortable talking about it. They bring their own, we didn't talk about this in my kitchen table, to the exam room. So there needs to be a cultural reframing and a medical education retraining. So that was a really long answer as to what the bedroom gap is, but it shows you how the book is very broad, but it has very specific ways to help yourself and kickstart things for yourself. It talks about self-love. It talks about how to deal with infidelity or same-sex sexual issues or online dating. I mean, internet dating is its own crazy thing, right? So there's a lot packed into a little 250-page book, and I can't wait to send one to you and have you read it. I think you'll really love it. Maybe we can do a round two after
I
you.
was thinking that I would absolutely love that because I know that today my intention is you're going to have the advantage of all the things you just talked about. We're going to unpack the things that can help empower the women that listen to this show and then who can go share it and get that message out more broadly. I applaud everything that you've done. And what I particularly love is I was noticing that, the description for the book, it says, the bedroom gap, rewrite the rules of sex in midlife, explores closing the communication divide around midlife sex, which can lead
Mhm.
to gender equality. That
Yeah,
speaks both to you and what your mission is, because you could just help empower people in the bedroom, if you will, or help unpack this stuff. But gender equality takes it to another level. And I understand from your TED talk, I mean, over a million people saw that your work is global. Like you have a bigger vision for how you want to impact. So let's just unpack the gender equality piece because I've never heard anyone talk about women's sexual health and understanding the issues and connecting it to really like what is more of a female movement in general. Like this is
right.
cool.
It
Yeah.
is cool. And I guess if you asked me what's my mission with a capital
Yes.
M, it's really to close the gendered healthcare divide. I mean, I'd love gender equality across the board, but we are still paid 80% of what men are paid for the same job. That's 55 years after the signing of the, Equal Pay Act. So,
Yes.
whoops, that just didn't happen.
Yes.
So I don't have any fantasies that this little book or my TED Talk are going to fix gender equality. But I feel like if I could take a sliver of healthcare where there's enormous and widespread inequality in research dollars, in the $47 billion that the NIH has to spend, only 8% of that is for women and children. They lump us all together. Like we're some, two minorities, just shove them together, or that women are only of value if they're related to childbearing. Of that 8%, only a quarter of it is for women's health slash menopause stuff. So just the NIH budget needs to be radically revamped. And I guess where I landed on the sexual piece is that I started feeling about, okay, I can't just march up and have the NIH change things. I can't get women equal pay. But what if I could talk to women directly and say, you can make your own little needle move forward in your own bedroom? In the world of sex in terms of just communicating with your partner so you feel it's an equal relationship and you learn to advocate for your own pleasure. Why do I care about sexual pleasure? Because believe it or not, sexual pleasure is linked to health and longevity. So if I could get women being sexually active longer, that means a longer sex span. That's what we call it. They are less likely to be a lonely older woman. They are less likely to have stress, anxiety, depression, poor sleep, high blood pressure. All these things have been shown to be related to a lack these issues to a lack of being sexually active. And it's free, it doesn't have side effects. And so I felt like, and also because it was sort of I wanted to unwrap and undo the shame that we
Thank you.
link between women and sex and women and their genitals. Why is it that
Yes.
men can talk about masturbation or having sex or how many women have you slept with and they high five it? But women who talk like that, it's like, what are you? What you're strange. And I thought that's ridiculous. Why is it that a male penis has been sculpted for thousands of years and we all accept it? Okay, David was handsome, wonderful, beautiful sculpture. But women, it's always this little wedge of tissue covered with a cloth, And so I just feel like if we can undo some of the shame and stigma and acknowledge that the humans that men are often having sex with are sexual beings as well, and that that's okay, that I feel like that's just a tiny step forward. So
It's
I think
huge.
very big, but I'm aiming for a small sliver. And that's actually what the TED team loved about the talk was they said it's one particular thing, but it's global. A woman in Sudan, Somalia, Singapore, and Paraguay can all identify with what you're saying. And so I think that's why they liked it for
I
TED.
think it's amazing. I think this is amazing. And you don't know what the ripple effect is of that, of a woman not feeling that shame, of a woman advocating, of a woman embracing and knowing that she was designed for pleasure too. And it's not
Hmm.
shameful. And she should want that and desire that. And she deserves that. And we're going
Hmm.
to unpack some of the stuff that happens in midlife that might kind of put some
Make
brakes
that.
on
Yeah.
it. Yeah.
Yeah. Yeah.
So actually, let's do that. So, what are some of the issues that women are dealing with as they hit midlife, and what roles does like our sex hormones play as they're kind
Yeah.
of fading off? Yeah,
Well, I mean, if we had 6 hours, we could go through the 34 main symptoms of menopause from your ears to your eyes to your mouth to your synovial fluid in your joints
oh
to
God,
the aggregation and calcification of plaques in your coronary arteries to bone health to brain function. But
wow,
let's just smush that all in and save it for another time. The sexual and genital effects
yes,
that happen and the brain effects that happen when the ovaries make estrogen and testosterone more erratically. That's called perimenopause. And when they make it in a very tiny or almost negligible way, that's called menopause. We say the ovaries basically shut down. When that happens, the brain gets deficient in estrogen and testosterone, and the brain really needs both for many things, brain recall, memory recall, word recall, so many different things that any perimenopausal or menopausal woman knows. Mood
totally. I don't
stabilization,
know what you're
sleep.
talking about. No, I'm
Yeah,
kidding. I'm
exactly.
teasing. I'm teasing. Yeah,
Since we're only 25, we
that's
can
right.
only look
Right.
forward to this.
Yeah, yeah,
But also for libido, it does
yeah.
affect our libido, our actual desire to have sex. And
Mm,
I think we should talk about that separately in a second.
okay.
But at a genital, like what happens to the vulva and the vagina and the clitoris, they all get affected. They have receptors for estrogen, and parts of our genitals have receptors for testosterone. So when we lose both, it literally, if you go to my TED Talk, if anyone out there has 14 extra minutes, Google TED Talk Maria Sophocles, not to watch it, to watch the 30-second little animated video within it that shows what happens in the vagina when we suck estrogen away, when we take estrogen away. But just to be a spoiler, we lose blood vessels. And so when we lose those blood vessels, we can't make moisture. The moisture can't get to where it needs to go. So we can be as turned on as we want in our brain, and there's just not much moisture made. And then we also have collagen breakdown. This is the same reason, in part, that we get wrinkles and breast sag. And collagen breakdown happens a lot of places in our body. But when it
Yes.
happens in the vagina, we lose elasticity. And you really need elasticity to have comfortable penis and vagina sex. We also lose nerve endings and blood vessels around the clitoris. And as any woman listening to this knows, most women really need their clitoris to function to have an orgasm. It's a huge myth and misunderstanding that women have orgasm from penis and vagina sex. There's only about 15 or 20% of women that exclusively have orgasms from the penis and the vagina. Most women need the clitoris stimulated in some way. So when the clitoris literally is not healthy, is it any wonder that orgasm takes longer and is more sort of anemic, let's say, more of
Yes.
a gasp than a scream. And so women come in all the time just saying, I just can't do that anymore. And it's embarrassing. And he's trying, he's really lovely, and nothing happens, which just makes me really self-conscious. And I'd rather just not have sex. I'd rather just binge Netflix. It's just more enjoyable. I'm tired. I'm busy. I don't want to have to the anxiety of not performing. And I think this is where we can also really say, what if we rescripted the term sex? What if sex didn't have to mean penis in vagina till the man ejaculates? Like, why don't we just open our definition up a little bit to just mean pleasure in however this couple chooses to have pleasure.
Right.
Same-sex couples are much better at doing this, by the way, than heterosexual couples. And that's probably why their orgasm rates are higher. When we look at, there's an orgasm gap too between heterosexual men and heterosexual women. Mu Huge gap. When we look at same-sex couples, there's not so much of an orgasm gap.
Interesting.
So it's kind of interesting, right?
It's all very interesting. Is there a solution then through either vaginal estrogen or menopause hormone therapy? I get
Yeah,
MHT. Does that actually
yeah,
help? Does it revive it back to where it was, or does it just get you kind of a
yeah.
little bit better? Like what can someone
Oh,
expect?
yeah, that's a great question. So, first of all, there are non-hormonal answers to this question
Oh,
and hormonal answers. So
great.
you just offered the gold medal, but there's a silver and bronze also
Perfect.
that are
Okay.
perfectly great.
Yes.
Although everyone wants the gold, but many women are still afraid to use vaginal estrogen, and they
Yes.
haven't really kept up, or their doctor hasn't, with the fact that vaginal estrogen has been shown to be safe and healthy for basically all women, even women who had cancer, which is kind of stunning, but it's because it works locally. Systemic estrogen is safe for many women, most women, but not all women. If you have a cancer or had a cancer that was estrogen receptor positive, you're
Yes.
not going to be offered estrogen systemically. We call that HTU, or ET.
Okay.
You have a uterus, you have to take progesterone with your systemic estrogen. So if you get prescribed an estrogen patch or gel, you must use progesterone by mouth or as an IUD with that to protect the uterus. Estrogen itself is extremely safe all over the body, but in the uterus, it causes tissue growth. And when you're menopausal, you don't want that. It could even cause abnormal tissue growth.
No.
So if you have a uterus, you must use progesterone also. It's the yin to the yang. It's sort of
Okay.
the
Yeah.
anti-growth. So that's fair, that's easy.
Yes.
But I think the really important point I want everyone listening to hear is that vaginal estrogen and systemic estrogen are not identical. They're not the same thing.
Yes.
And they help the vagina differently.
Hmm.
Vaginal estrogen, even though it's a teeny, 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 tiny dose, because it's going right into the vagina, it's very powerful and adept at turning around those cells, at making collagen and blood vessels, and making you very, very happy with the results.
Okay.
Systemic estrogen is also helpful, but less so. Think of dilution, right? Think of if I take a pill, by the time it dilutes in my bloodstream and gets all the way to the vagina, there's
Yeah.
very little of it left. So expect a partial credit help from that. And don't
Okay.
be surprised if you're still having dryness or discomfort and your clinician says, well, let's add some vaginal estrogen. You're not overdosing, you're not double dipping, you're not increasing risk of cancer. You're just putting the effective estrogen right where it's needed. And the other cool thing about vaginal estrogen, you don't need the plunger. You can just use your finger, and you can even put it exactly where the dryness is. For many women, this is right at the opening, right at the entryway. Weird name. We call it the vestibule, just like the entrance of a church, but the vestibule. And
Okay. So with the
uh,
vaginal estrogen, do you have a preference between like like the
the
suppository
ring,
versus
the
the ring? Yeah. No.
whatever's covered by your insurance and
Use it.
whatever you're comfortable doing, whatever.
Yes.
Some women like putting a ring in and forgetting about it for 3 months. Other women like the cream because they can put it at that opening where the discomfort is. Other women like little suppositories because they're just so easy. There's
Yes.
not a lot of mess. So
Yes.
I would say go shopping with your clinician. I keep a poster on the back of my exam room doors and I say, we're going to go shopping now and you get to pick. And
Oh, nice.
if it's not covered by insurance, we'll pick something that is covered by insurance. If you don't want to use a vaginal estrogen, there is a vaginal hormone that is a cousin of estrogen. It's more like testosterone. That's available too as a suppository. If you don't want anything vaginal, there is an oral medication that is not hormonal at all
Hmm.
that turns on estrogen receptors in the vagina
Oh.
and the bladder and the bone. So you get free osteoporosis prevention, whether you want it or not. That medication is called Osphena,
Hmm.
Osphena. That's the brand name. Hope it's okay to use that. And I love it for women who also have osteoporosis because they're just getting extra help, kind of whether they wanted it, or not whether they wanted it, they want it, but one pill taken with food every day, it's quite safe. So something to think about. And if someone says to me, well, I don't want any prescription at all, I really just want something that I can get online or over the counter, there are vaginal moisturizers. These are not lubes like you use them before sex. They're used twice a week, suppositories, and they have hyaluronic acid
Hmm.
as an ingredient, just like high-end skin products do. They pull moisture into the inside of the vagina. They rob Peter to pay Paul, sort of pulling it from behind the walls, but guess what? They work. It feels moist in there, and it can make sex more comfortable. But remember, you're just kind of faking it in a way. You're not
Yeah.
making new collagen, and you're
Yeah.
not making new blood vessels. So look, I listen to my patients very carefully. And if they say to me, you can tell me anything you want, I refuse to use any prescription medication, I have to ask myself, I want to help this woman. I want her to
Yes.
leave happy and call me in 3 weeks saying, I'm better, it's more comfortable. So
Yes.
vaginal moisturizers can do that. So that's an idea, vaginal moisturizers. And then, of course, there's lube, which absolutely nobody should be afraid of or ashamed of. You should literally share your decision to use a lube with a partner instead of keeping it hidden under the pillow and squeezing some in your hand. I mean, your partner should actually be excited that you care enough about sex to want to have comfortable sex because it's better for your partner. So I think women can learn this scripting. This is what my patients do with me. We practice together, leaving the lube out on the bedside table and even saying, check it out. I found this lube. It's got aloe in it, or it smells really nice, or it's strawberry flavored, or whatever your version of fun is. And actually flipping the table and saying, this is going to be fun. Let's try it. Because you can't fake moisture. If you don't have those blood vessels, you can't just will it there. And it'll take about 3 months for vaginal estrogen to do its thing,
That's good to know.
but
And
you
will it
can
go
use it
back?
forever. It will go back. It is amazing how
Yeah.
great it is. The
Okay.
other thing on the menu, the last thing on the menu, is not a medication at all. It's a laser therapy that I pioneered. I brought
Yes.
from Italy, oh gosh, 10 years ago, 11 years ago, because it was invented in Italy and they didn't have it in America. And I thought this is a cool option for women who simply will not take a medication, and 10 years ago, really, it was hard to get women to use vaginal estrogen. So that laser is a CO2 laser. It's the same thing people can use on their face for a laser facial,
Oh,
but it's
wow.
been designed with a specific probe for the vagina. The brand of that laser is Mona Lisa Touch, a sort of cutesy, corny name because it was invented in Italy, and
I
that's where I was living. It does
love
work,
this.
but the bad thing about the laser is that it's not covered by insurance. Insurance
Oh,
companies don't care. I mean, there's something called the pink tax, which means if it's for women, it's more expensive. It's for women's sexual health, forget it,
right.
So you do need to
It's
be
not
prepared to pay
free
out of
or
pocket.
whatever like
No.
they would for men. God
Yes.
forbid we let the men, yeah, go through anything
Get
we
their
have to go through.
Viagra,
Yeah,
right,
I
but they don't
know.
have to.
It's unbelievable. It's not
Yeah, that's in my
okay.
book. That's a total double standard.
It's
Total double
such a
standard.
double standard. What I love about this conversation is that coming from a doctor who's been doing this for 30 years, it lets women just understand, like you've seen this from patients, you've heard everything, including from your travels and obviously from your TED Talk and getting the feedback. So it's helpful to hear it from you specifically. And I think it's going to give women more confidence to go in and speak to their own practitioner and say, hey, listen, you know what? Can we discuss options? Not,
Yeah.
I don't know if they'll get the same menu that they would from you, but even if
But now they've heard it thanks to
but that's what I was
you.
going to say
Now
that.
they've
Well, no,
heard it.
thanks to you. Let's actually talk about testosterone because I've never discussed it on the show specifically. You mentioned that there's receptors for testosterone as well. So,
Yes.
what do we know about testosterone and is it being
Yeah.
recommended? Do you recommend it? Like, what are your thoughts on it?
I've
I'm just
been
very
using it.
curious.
Yeah, I've been using it with patients for probably 20
Oh,
years.
you have?
So, yeah, it's kind of new and in vogue
Yeah, no,
now
for
in the
sure.
mainstream. Because remember, some of the influencers out there are people who are new to studying
Right,
menopause. They just came to the menopause conference last year. They
right.
got all excited and they have 300,000 followers. So I'm happy that they're talking about it. But I've been using testosterone, my mentors and I, for decades. And
Okay.
that's because the female body, the ovaries, have been making testosterone in your body and mine since we were in our mom's wombs. So we have had it as little girls, as teenagers, as adult women. We have always had it. It's always been there to help lots of parts of our body, and it goes away just like estrogen. But our society has decided to genderize. I don't think that's a real word. I'm just
Yeah,
making it
no,
up.
but I know
Hormones.
exactly what you mean.
So
You're right. We
remember
think it's
that book?
male hormone versus a
Yeah.
female hormone.
Yeah. Remember
Yes.
the book Men Are From Mars,
Mars
Women
women
Are
are
From
from
Venus?
Venus. Yeah.
Men have testosterone, women have
Have
estrogen. I
estrogen.
bet if you ask most people, that's what they think.
Yes,
But men
agreed.
make estrogen and women make testosterone.
Mm,
And so the question is, do we need it? And the answer is, well, we always have needed it and we still need it, but we've learned to do without it, just like we've learned to do without estrogen. But I
yes.
ask you, does that mean we should do without it? Like me, I don't know about you. I don't want to get osteoporosis. I want to be an 85-year-old grandmom on a stand-up paddleboard with my grandkids, not in a rocking chair because I can't get out of the chair. I want that
Wait,
estrogen in my bones.
wait, this is helpful, but does testosterone help with that too?
It does, but I was bouncing all around. It's really estrogen that's going to
Okay.
help with that. But
Okay.
testosterone will
Got it.
help the vagina, the clitoris. There are testosterone receptors all around the clitoris, the labia, the lower third of the vagina. They're in the
Yes.
brain.
Yes.
That's why when we give women testosterone, they have more interest in sex. They initiate sex. Um, when we put testosterone cream on the clitoris, we can how do I put it? Regrow nerve endings and blood vessels. And guess what? The clitoris itself is more responsive. Orgasms happen more readily and more robustly. And so we use testosterone either as a compounded formulation. Remember, this is not FDA approved.
Right.
I'm sad about that. I wish it was.
Because it's
Um,
for women and they haven't studied it probably.
No, they have, and a company put 980, I think, $1 million into
What?
making a testosterone product, brought it to the FDA, and it got one vote away from being approved. This was years ago,
Oh, wow.
and I wasn't there, but my mentor was in the room, and he said it was so sad. They basically said, I mean, do women really need something for libido and to feel better? I mean, this is kind of ridiculous.
Because we're
And
obviously there to please the guys anyway, so it
that's
doesn't
right.
really matter.
That's right. And even the data was strong,
Ah,
but they said no thank you. $980 million flushed down the toilet, and a lot of women deprived of an FDA approved option. But it's coming. So stay tuned. I'm not allowed to share anything
interesting.
more, but before you and I are 85-year-old women, it will
It
be
will
out
be
there.
approved.
Yeah,
Well,
it will
and
be
you can get
approved.
it compounded from your
That's right.
gynecologist. Yeah.
And we do it in a very safe way and we
Yeah.
track
It's
the
not the
levels
same
of
dose. Yeah,
testosterone.
it's men. No,
Mm-mm.
of course not.
Now, some women use a male version and we just have them use a tenth of the male dose. So that's the other thing is you can order something that you can pick up at CVS or Walgreens that is a male product and you just have to, it's kind of really tricky. You have to just use a tiny, tiny bit of the dose. But at least that's
An
a
option.
product that's
Yeah.
been FDA vetted, so we know what's in the bottle is actually probably what's really there. two awkward and imperfect options, but that's what we do. And in
Yeah,
some cases, we give patients injections if they need really more oomph. Um, this is a little scarier because the doses can go really above what normal female doses are pretty easily. So if
right.
you're doing that, you want to be in the hands of someone who is really experienced with using testosterone. I'd be very scared if it was some strip mall shop that talks about hormone balancing. Like those people, no, it's possible
No,
now. They'll hire a
no,
doctor just to sign the prescriptions. And
no.
yes, and I've had patients come in with really, really high testosterone levels, like and acne and chin hair and deep voice. And because the doctor just kept signing higher and higher doses without ever seeing the patient. And they're saying to me, do you think I have to live with this? It's like, oh my gosh,
What have they
no.
done?
Yeah, what
Yes.
have they done? So please be careful with who gives you the testosterone. Please make sure there's someone who's used it a lot with their patients and is comfortable with and understands and can explain to you a normal female level. And look, I will confess that I'm comfortable being top normal, even a little above that, to give women some libido back and energy back, but not super crazy, crazy high, even
Right.
though honestly the safety data is very good. Like we have women, look at the trans population. We've given women who are, transitioning to being phenotypically male, very high doses, and they don't get cancer or heart disease. They actually
Interesting.
are okay. They get a beard, but they want that, right? So if we know those women, aside from the beard, are safe to do that, those men, those trans men, then you and I can take a dose that's a little
Interesting.
high. I mean, obviously, once you're getting side effects you don't want, we tweak it, or we don't do that. We try to avoid any negative side effects. But yeah, that's what we do. And honestly, it's very happy patients. Very
Absolutely. And if women, so it sounds like just I'm making sure I understand, you can reclaim your, if you've
libido.
got, yeah, well, your libido, and if you've got the dryness, you can reclaim that and the
Yeah.
orgasm too, or no?
Yeah. Yes. Yeah.
I would like you to address the younger women that might be listening. If you could give
Uh,
some advice and say, listen, this is what's coming because it's just biology. What advice would you like to give them about what they can be proactive about or be aware of now? Since there is
well,
no real good sex
yeah.
education. I literally, they were like health class, read this chapter every day. Like nobody talked to anybody about anything.
I know. And most of the young women listening had sex ed that was as crappy as mine was, and probably yours was. Mine was fear-based. They tried to, it was like
Don't get
bridesmaids,
pregnant.
not bridesmaids,
Don't
don't
get
get
pregnant,
pregnant.
right? Yeah, yeah,
Yeah,
yeah.
not bridesmaids. What
That's
was
all
it?
it's about. Yeah, I
Yeah,
know what you're talking about.
don't get pregnant or you will get chlamydia and die. And my sex ed was like that. We practiced putting condoms on bananas. Like you can't ever have sex without a condom or you're gonna get herpes. And believe me, I want people to use condoms and not get herpes.
No,
But it was
we
all
didn't have
fear
anything like
based.
that. It was just read these chapters. There was literally, there wasn't even that level of discussion. Maybe that's
So
at least
think
a
about
step
how
up.
little those chapters related to how you really began being sexually active. Not at
Mm,
all, right?
mm.
And I'd say to the young women listening, whether they're 25 or 35, that I'd love you to embrace the idea of sexual pleasure for yourself. I'd love you to start learning about sexual pleasure yourself by knowing your anatomy and knowing what feels good, whether that's a shower head aimed at your vulva or a vibrator or touching yourself or just getting pleasure from stroking the inner aspects of your arms, whatever feels good to you, I want you to learn that. And I want you to feel like you could share that with a partner. This is what women are terrible at doing. They sort of imitate what they think they're supposed to do sexually, including moaning and screaming and faking orgasms. That's widespread. And it's like when you were in gym class and they said, everybody's going to do 50 push-ups. And you kind of looked around and when no one was looking, you went 41, 49, 50, and you were like, woo, nobody noticed. That's not serving you. You're actually not getting better at doing push-ups.
That's so
And same
relatable.
thing with your orgasms. If you're faking them, you're not helping your partner to know the pleasure you are or are not getting. But your partner may not know exactly how to please you too. Remember, men are learning all this from porn. And in
That's
porn, the
so
women are,
frustrating. What is this? It's so broken,
well,
Dr.
and
Maria.
I
It
know,
makes
but
me
that's where we
angry.
are. That's the number one way and place that men learn, quote, how to do sex. So let's talk about porn because in porn, the women all orgasm from penis and vagina sex. So that's the first big
At the
myth.
same time, like in the Hollywood movies, too.
Oh, in 7 seconds and standing up next to a car. Like, please, like just think about how unlikely this really is. And then women feel so bad that they're not, right? And that's so the best thing
Oh,
you could do for yourself is actually know your anatomy, know what gives you pleasure. And if you want a hack, go on omgyes.com. I think you pay 25 bucks for a lifetime membership or something like that. And it's thousands and thousands of videos that real people make saying, okay, I never could have an orgasm until I kind of did this. And here's a drawing of what I did. Or here's me like angling my hips. And when I did that, and this sounds so silly and embarrassing, but some women will go, that's what I need to do. And that's what we have to do because our medical education failed our doctors and our sex ed teacher, our gym teacher who got stuck teaching sex ed,
totally. Why
that's
was it the gym
totally,
teacher? That's so weird.
oh, they drew the short end of the straw, I think,
Yeah, thinking back,
but
it's true. You're right.
so they have to go somewhere, and that's why people end up at porn, and men do it because, oh, cool, they learn to masturbate to porn, but women aren't even taught that masturbation is okay, which, oh, hello, it is. So I think for the young women out there, don't worry so much about what's going to happen in menopause today. Worry about how can you be sexually comfortable in your own body. And if you're not sure, in my book, The Bedroom Gap, we do a quick anatomy lesson. We do a little lesson on how to have an orgasm, how to masturbate, how to talk to your partner, how to talk to a partner. That's completely never discussed. I mean, no mom ever sits down with her daughter, or very few. And they say, look, if you're not getting the pleasure you want, I want you to look him right in the eye and say, let's do more cuddling. Let's have more foreplay. I mean, that is unfortunately just for a 20-year-old in college or something, just not the conversation, especially because in colleges, there's often alcohol or hookup sex. And so those two factors make communication and orgasm much harder for women. And that's been studied. The orgasm rates in hookup sex for women much lower than in long-term relationships. So for young people, I'm not poo-pooing hookup sex. You do it if you want to do it, but know that you're probably getting the Walmart version of sex. You are trading away something. So maybe figure out how not to trade it away. And you can still have hookup sex. You can go on Tinder or Match or anywhere you want and meet as many people as you want and have as much sex as you want. That's not for me to judge. And I think the good thing about having many sexual partners is it can help you learn what you like. And it can help you if you have a partner in a long-term relationship who maybe isn't as adept sexually, and you had a partner who was an amazing lover, even if that relationship didn't last, it gives you an idea of what can be. So I would say don't settle. Don't settle for meh sex. Is
Yeah. And
that all right?
actually, your advice is good for a woman of any age because the truth is, there's so much shame around it, like you said, and
Yeah,
people might be in just like these patterns with their partners and not actually still advocating or enjoying it in the way that they want to be because they don't know how to broach that kind of a conversation.
exactly.
Can we talk about the discrepancy in desire too? Because it's
Yeah,
interesting when you're talking about these hormones and how they impact the brain, because for women, so much of it is like our minds are a big part of it. It's not
totally.
just the body, it's the brain. It's like what we're thinking
Right.
about. And if we're thinking about dirty dishes or like all the stuff we need to get done, that's not
There's a
very
great,
cool. Like that
no.
doesn't work.
No, there is a great, I just gave a lecture and I put this up there. I got to find it and send it to you. A great New Yorker magazine cartoon. And
Yeah.
it's a woman in bed reading, and the man comes up to the bed and he's got a vacuum cleaner, a dish rag, a duster. Like he's been cleaning the whole house. He's got every tool in the book. And he said, honey, don't you have any fantasies that don't involve me cleaning? So clearly she told him, my sexual fantasy is to watch you clean the house. And I just love it. I
I
love it.
love it.
And it really underscores your point that for women, sex is contextual. Sex
Yes.
is in the context of, are we getting along? Are you respecting me? Are you kind to me? For men, it's also contextual, by the way. So I don't want this to, you
Yeah.
know,
Yeah. Yeah. We're
this
not
isn't a
bashing
crap on
men.
men thing,
No,
not at
never.
all.
No, no, no. I'm
But
not of
they are
that
more
mindset.
easily okay having sex just for the physiologic kind of release. And this this is where we come up with two types of desire. There's spontaneous desire. This is more common in men. They see a picture of a woman in a bikini and they desire that woman and they desire sex with a woman. Women have more commonly something called receptive desire. They get a back rub, their neck is kissed, their back is stroked, their hair is swiped back. The man puts on lovely clothes that they love. There's all this context, and it makes them kind of say, "Oh, oh gosh, I'm kind of turned on." They start kissing, they start fooling around. The kissing feels really good. Their vulva gets tingly or their labia are swelling or their hands get sweaty or their heart starts beating or all these things start happening, they're getting aroused and the desire sneaks in through the back door and then they have desire, which is
Yes.
crazy. It actually flips the script that you and I think, which is you have to have desire first. If you don't have desire first, no sex life.
Right.
But for women, if they can get aroused, and this is what I often coach my patients in, how can that arousal happen? And you find what gets you aroused. Is it he's doing the dishes? Is it he's dressed up and you love to see him in this smart sports jacket? Is it a naked time? Is it watching porn or not even porn? Is it watching, Bridgerton together or watching some steamy scene on Netflix that's not even super steamy, just a little steamy and holding hands? I mean, whatever it is for you, you can find that desire happening as a result of actual arousal happening. So that's kind of my good news for anyone listening out there is you don't have to come in like my patients always come in and go, just give me something for desire. I just want to have desire. I have no
Like they want to
desire.
take a pill and it turns on in their brain or
Well,
something. Yeah, that's,
it turns out there are two meds for this, though.
oh,
I don't know
yeah.
if your listeners don't know that, but one of them is called Addyi,
Oh, yeah.
Addyi.
Yeah.
Addyi was approved in 2008 for low sexual desire in premenopausal women. And on December 15th, a month ago tomorrow, it was approved for postmenopausal women.
Oh,
It's a
interesting.
once a day pill. And I mean, it's something to consider, something to definitely look up and look into. Some women don't like that they have to take a pill every day just to have sex twice a month or however often they have sex.
Yeah.
But other women say, look, I'm having sex 0 days a month and it's wrecking my relationship. If it makes me have sex 2 days a month, that's good. My partner will be thrilled. So you do you. If it's right for you, look into it. The other is actually an injection called Vyleesi. It's quite expensive. It's not always covered.
Yeah.
Um, and it's an on demand. It's more like Viagra. You take it an hour before you want to have sex, and it releases all this dopamine, and you really, really, really want to have sex. So that's kind of
Interesting.
cool
Yeah.
also.
Yes.
So there are medications. I mean, most of my patients don't want them. They
No.
just want to have better sex without them. I mean, I'm telling you about them because I want
Yeah.
people to know.
No, no. Education, knowledge is power, and I appreciate that. One of the main reasons I launched the show was to invite women off the sidelines into her starring role. We sideline ourselves, we get sidelined. You talked about not even having equal pay in 2026. It's mind-boggling to me. It makes me so angry. So, what advice would you give to a woman to invite her into her starring role as it relates to her sexual health, like to enjoy pleasure without the shame? Like, what can you say, like, to her today to take all your years of experience and just impart her with something inspiring or like encouraging, something to
Yeah, so when we think of sex,
prioritize herself in that regard and know that
well,
she's worthy of that?
for sure. So the easy short answer is prioritize sex in your life. Why? Because sex is fun and sex is play. Most people who aren't having sex and don't feel like having sex and they're too tired to have sex and they're too busy to have sex, when they do have sex, you know what they say? Oh, this feels great. We should do this more often. Right? That's really common. So they're confused because they say that, but then they go 6 more weeks and then their husband's frustrated and then they feel bad and the cycle repeats.
Yes,
So I would say if you prioritize it, if you remember that it's play and it's fun, and play and fun are so good and they're so lacking in our lives, then I
totally.
think that that's my super quick and dirty. You only have 15 seconds, say something that people can think about. But a slightly longer answer is that you can think of our sexual inspiration and inhibition as an accelerator and brakes, right? We have things that inspire us to want to have sex, whether it's the drink you had or the edible you took or whatever, the new lingerie you put on and you feel great, or you've gone to Aruba for the weekend with your partner, or you injected yourself with Vyleesi, whatever it is. But we also have inhibitors. Your mother-in-law in the next room, this sick kid in the next bedroom, your mortgage payment that you can't pay, you got fired, your son's failing calculus, all these things in your head,
Yeah.
or you gained weight and you hate the way you look, so you slide under the covers quickly. There's so many things, and women are so hard on themselves. So I would say find the courage to do a good look in the mirror at what are the breaks. I think it's more important to take your foot off the brakes than to put it on the gas pedal. I do.
Mm,
And I think
that's
take your foot
interesting.
off the brakes. Is it your weight? If it's your weight, look in the mirror and say, you know what? I actually look pretty darn great. I'm 58, I'm 55. I had two kids. I had a C-section. You know what? I'm okay. And look at me in this little nightgown. I look pretty good. So whatever the breaks are, you need to lose those breaks. If it's your mother-in-law in the next bedroom, then once a quarter. Start with once a quarter. Go get an Airbnb 20 minutes down the road. You don't have to wait till you can afford to go to Aruba, and say, we're having a weekend just for us. And know that you're thinking, I'd like sex to be part of it. So something like that, I think, can really help you to maybe initiate or maybe take steps forward. Not unlike I need to start exercising and lose weight. You can't climb the mountain until you take the first step and
Mm.
until you make the time, you know?
And like you
So I
said,
know these are
prioritize
hard
it. And
things.
like you said, prioritize it. Okay, just two fun questions to wrap up. As a board certified OBGYN that teaches about the bedroom gap, I would never.
I would never tell you that there's only one definition of sex. And I would never feel like tell you that you're a failure because you're not having penis and vagina sex. My point is that
No, I get your
you
point.
can define it for yourself. And if your definition of sex is we cuddle and hold hands and we giggle, or we give naked massages and that's all we do, and you're happy and your partner's happy, then you don't have a bedroom gap. You have a loving relationship. Seek out intimacy and affection more than rigid definitions of sex. And here's why: intimacy and affection are the parts of sex that lead to longevity and health. So if you do nothing else,
Cultivate that.
cultivate that for your own health, right?
I love it. Okay. And as a board certified OBGYN that teaches about the bedroom gap, I always,
Oh, these are hard. Always and never are
it's,
so
I
hard.
know it's more
I never
playful, but
restrict myself. I know, I love it. I never, so the never was don't restrict your definition of sex.
yes,
And the always is, I always think that communication is so critical between you and a partner. Short term, long term, hookup, same sex, different sex, anything at any age. And don't ever be afraid to do a sexual check in. If you've never done it, do it. If you've done it and it's been years, do it this week and decide you're going to do it monthly or yearly or quarterly or whatever. And a check in can be something as simple as a statement. It doesn't have to, it can be like, I really loved how when we were in Aruba, blah, 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 this happened. Or I really loved last week how you massaged my scalp when I was so tense. And I'd really love to do that more. It can be a simple compliment that says more than a compliment, that tells your partner. So I always promote communication as lubrication, right? They say communication is lubrication, communication as a way to move the sexual needle forward.
I love it. This has been such an amazing conversation. We should definitely do a part two at some point. In the meantime, though, when this comes out, your book will be out. So where can I direct my audience to find you online to get the book?
Yeah, so the book is available through my website, mariasophoclesmd.com. It's available on Amazon now and lots of other booksellers uh, online and they'll mail it out on February 10th. February 10th, the book comes out, the Audible version, which I've narrated, so people are stuck
Oh,
hearing me
cool.
for eight
No, you're
hours.
so fun.
Um,
You're great. Yeah, you have a great
and
voice. You have a great voice.
Thank you. And I think that's the easiest way to get it. Figure out what you like. Do you like to listen to it or read it? I think it's really going to be fun also for men to read. It's not slamming men or anything. So buy one and buy one for a man in your life, your nephew, your uncle, your cousin, your brother, your partner, to say, I think this is important that we all know about this. When men come to my talks, I'm always so touched and so impressed, and to me, these are the super evolved men. So let's try to get the men in our life evolved. Believe it or not, they want to be.
Of
They
course.
might seem like they're ashamed and ooh, that's not my thing. They
Yeah.
want to know what we need. Yeah.
Yeah. They're ready for a new conversation around this too.
Yeah. And also
Lit
find me on Instagram
Oh
too,
yeah,
Michelle.
for
People can find
sure.
me on Instagram. It's mariasophoclesmd.com. And I think I'm starting a new one, Dr. Maria Menopause, because so many
Oh,
people
cute.
ask me about menopause. So we'll
Oh,
see.
good. You
Let
might
me
have
get
a
that up and
second.
running.
And
Yeah.
ladies, as you know, all of the show notes are on your podcast player with every link that was referenced today. It will be there, easy to accessible and to reach Dr. Maria and to find her book. Share this interview with every woman you know and guy. Let's get this gender
Let's get
equality
this party
going.
started.
Let's get this party started. It's time. Thank you for the work you're doing. This has been such a pleasure, and you're welcome back anytime. I'd love it.
Thanks, Michelle.
Thank you, Dr. Maria.